Welcome to the Megacast. I'm Tyler Kieft in the studios of our flagship station, Civic Center TV and 89.3 Lakes FM. In addition, today, as always, we're also on Comcast, Channel 15 and AT&T Channel 99 in the Birmingham-Bloomfield area, on Birmingham Area Municipal Access, and in Southfield on City Cable 15 of Southfield. Join us in Lake Orion and Orion Township on ONTV or Orion Neighborhood Television, as well as in Waterford on the Media Network of Waterford on Channel 10. On the radio in the Birmingham, Bloomfield, and Troy area on 88.1 WBFH, The Biff, and online in multiple places. First place to go, CivicCenterTV.com. Click on our Watch Live link at the top of our homepage on your computer web browser or in the left margin of the screen on your drop-down menu on your mobile phone. You can also find us on Facebook, facebook.com/CivicCenterTV15 and facebook.com/LakesFM. And then on My Michigan TV or My Michigan's free streaming network with programming for Michiganders by Michiganders, all about Michigan. That is at MyMyTV.com, MyMITV.com. And there you can watch our live programming from 10 a.m. to 12 noon. Other live programs from 1 o'clock to about 3 o'clock in the afternoon on most days. Today will be about from noon until about 3 o'clock on most days. Today it'll be from about noon to 1 o'clock with Steve Lato Live happening after our show. And then you can also learn more information on MyMyTV.com about how you can subscribe for free and where you can download the MyMyTV app on your smartphone and your smart TV. Places like the iOS App Store, the Android App Store, Roku TV, Apple TV, Amazon Fire TV, Samsung Smart TV, and more. It is My Michigan TV or MyMITV.com. And if you want to learn more about all of our partnering television and radio stations as well as our web outlets, and I can't remember all of those websites, all of those different places. Heck, it's tough for me to remember all of them on some days if you catch me on the wrong day. Go to our website, CivicCenterTV.com/Megacast, or click on the Megacast link, and there you will find information on each and every one of our partnering television, radio, and web outlets on the show with us each and every day. We have links to every single one of our partnering stations websites where you can learn more about all the other programming that they do, all of their other on-air personalities, and everything else that they do to support the communities that they cover each and every day, in addition to joining us here on the Megacast Monday through Friday from 10 a.m. until 12 noon. Also on our Megacast page is where you'll be able to access our full episodes and our short interviews on demand as well. You can get our entire interviews and our full episodes by clicking on either Watch Full Episodes or Watch Full Interviews. Again, CivicCenterTV.com/Megacast, where you can also submit through our form at the bottom of the page any ideas you might have for people that would be interesting for us to talk to, topics we should be discussing, or other news stories in the local area that maybe aren't being covered but should be covered in some way or another, and we may reach out to those people and discuss those topics on another edition of the Megacast. Right next door to our Megacast page, to the left at the top of the screen on your computer web browser, and just above in the drop-down menu on the left margin of the screen on your mobile phone at CivicCenterTV.com is our coronavirus link, CivicCenterTV.com/coronavirus. There you'll find important information about COVID-19 from trusted, reliable, expert resources at the federal level from the Centers for Disease Control and Prevention, at the state level from the Michigan Department of Health and Human Services, and at the local level here in Oakland County, where we originate our broadcast, through the Oakland County Health Division. In addition to all of those resources, we also have many of our local municipalities here in the Oakland County area and their direct COVID-19 web pages. Whether you live in the city of Troy, Pontiac, Auburn Hills, Keego Harbor, or anywhere else, this will take you directly to their COVID-19 pages, so you can learn more about how civic business in your town is being affected by COVID-19, whether it be certain services that may or may not be available in person at City Hall or at Town Hall or Village Hall, wherever it may be, or how municipal meetings are being conducted. Are they virtual? Are they in person? Are they hybrid? It's going to be different from one town to the next, and you can learn all that information by joining us on CivicCenterTV.com/Megacast. And then that's also where we post our top stories each and every day, making headlines about COVID-19 and more. Again, civiccentertv.com/megacast. As vaccine mandates at many different businesses, including our hospital systems, starting to come due, and that includes Beaumont Health, where 370 workers were suspended for refusing COVID-19 vaccinations, and 70 more had quit. This is from the Detroit Free Press. About 70 Beaumont Health workers resigned rather than take the COVID vaccine, and 370 have been suspended for failing to meet the October 18th deadline for vaccination, the Southfield-based health system announced on Thursday. Quote, "We are very pleased to report the vast majority of Beaumont employees have been vaccinated against COVID-19, the health system said in a statement. Beaumont operates 8 Metro Detroit hospitals and has about 33,000 workers. In a continued quote from that statement, quote, "We hope that those 370 employees will choose to get vaccinated and return to work soon. If they choose to not meet our requirements by November 16th, their employment will be terminated," end close quote. The hospital said it did not have details to share on how many employees who resigned or were suspended were nurses, doctors, or other frontline medical workers. Another 7% of Beaumont's workforce, or 2,300 people, were granted exemptions to the mandate. The majority cited a religious exemption, said Mark Geary, spokesperson for Beaumont Health System. Beaumont is one of at least 10 health systems in Michigan that requires workers to be vaccinated against COVID-19 as a condition of employment. Henry Ford Health System, the first in the state to announce a coronavirus vaccine mandate in late June, lost about 400 of its workers because they refused to get vaccinated before the September deadline. Another 1,900 of its workers were granted exemptions from the vaccine requirement for religious or medical reasons. So those numbers about equal between these two large health systems. The vaccine mandate comes at a time when health systems across the state are also grappling with a staffing crisis and frequently don't have enough workers to handle the volume of patients, both with coronavirus and other illnesses or ailments that are seeking hospital care. The situation led Beaumont and Henry Ford both to shut down more than 100 available hospital beds in September because there weren't enough workers to care for patients who would fill them. COVID-19 vaccines are required for workers at Trinity Health, Ascension Health, Spectrum Health, Veterans Health Administration facilities, Bronson Healthcare, Michigan Medicine, OSF Healthcare, and Munson Healthcare, with varying deadlines for when employees must be fully vaccinated. Though Sparrow Health System, McLaren Healthcare, and Detroit Medical Care don't currently have vaccine mandates, they will all soon likely have to require them to continue to get federal Medicare and Medicaid funding. On September 9th, President Joe Biden announced a sweeping mandate that would require healthcare workers at nearly every hospital system and health system in the country to get vaccinated or submit to a weekly coronavirus test. The Occupational Safety and Health Administration, or OSHA, is now drafting detailed rules implementing the order, but when they post those and when it is enforced is still yet to be known. That entire article from the Detroit Free Press on our website at civiccentertv.com/coronavirus. Also making news as we approach the cooler months of the year. Everybody's curious after a rain-heavy summer and early fall, what will happen when we reach winter? According to this article from the Detroit News, a warmer and wetter than average winter is ahead for Michigan, according to the National Oceanic and Atmospheric Administration, or NOAA. Michigan and the Great Lakes region is expected to have a warmer but a wetter than average winter, according to the administration. Southeast Michigan is predicted to have an almost 50% chance of above normal temperatures in some areas, according to NOAA's 2021 Winter Outlook Report, which is linked in this article on our website at civiccentertv.com/coronavirus. But predictions in a small part of the Upper Peninsula find, quote-unquote, equal chances for below, near, or above average temperatures. The report shows more certainty for Michigan than the 2020 edition, when the entire state's winter weather patterns were a quote-unquote toss-up, according to Mike Halpert, Deputy Director of NOAA's Climate Prediction Center. The report from NOAA's Climate Prediction Center for this year said, quote, seasonal outlooks help communities prepare for what is likely to come in the months ahead and minimize weather's impacts on lives and livelihoods. The predictions include weather forecasts for the country from December through February of 2022. The National Weather Service will use the report to release localized predictions around mid-November. The report also found a 40 to 50% chance of above normal precipitation in the region. Average temperatures for December through February in Metro Detroit are 31.3 degrees Fahrenheit, 25.8 degrees Fahrenheit, and 28 degrees Fahrenheit, respectively. National Weather Service records show that information. Average precipitation during those months is 2.25 inches in December, 2.23 in January, and 2.08 inches in February, respectively. Snowfall in Detroit has fluctuated in recent years, according to the Weather Service, National Weather Service, with 44 to 45 inches in 2021 and in the 2019-2020 seasons, up from 31.3 total inches the previous year, which was almost half of the 61 inches in the year before that in 2017-2018's winter from December through February. Increased rain and snow during the winter months could continue to cause damage that began in the summer, where widespread flooding hit the region. Fall in southeast Michigan has already seen at least one major storm in late September that resulted in nearly 5 inches of rain that led to flood warnings, following a rainfall and a thunderstorm-heavy summer that caused flooding and led at one point to power outages for over 1 million residents. In addition to the Great Lakes, NOAA also predicts a wetter than average condition in the Pacific Northwest, Northern Rockies, Ohio Valley, and Western Alaska. That entire article from the Detroit News on our website at civiccentertv.com/coronavirus. And finally, back on the COVID-19 front from the Oakland Press, Michigan's COVID-19 hospitalizations have gone up 24%, nearly a quarter, in the last 2 weeks. While there's much talk about empty shelves and supply chain woes, the COVID-19 pandemic remains an issue in Michigan, where hospitalizations are up 24% in the past 2 weeks. At Henry Ford Health System, since the beginning of October, they have seen a steady increase in hospitalizations due to COVID-19. As of Thursday morning, there were 181 patients in the hospital system. 2 weeks ago, that number was 144. Henry Ford Macomb and Henry Ford in Detroit lead the way with 45 COVID-19 patients each. Like other hospitals in Michigan and across the country, the vast majority of people being hospitalized and especially admitted to the ICU and being placed on a ventilator, they are unvaccinated, said Dr. Dennis Cunningham, Medical Director of Infection Control and Prevention at Henry Ford Health System, in a media briefing on Thursday. Inpatients who have COVID are tracked every day. Quote, we are not seeing vaccinated people really unless they have an underlying problem with their immune system, such as cancer, or perhaps they just had an organ transplant, Dr. Cunningham said. Cunningham continued, I'm not seeing healthy vaccinated people in the hospital, and certainly not seeing them in the ICU or on a breathing machine. And closed quote. For the week ending on October 10th, 779 positive PCR tests for COVID were recorded. That's up nearly 47% since the week of September 12th. About 11.2% of tests are positive. Quote, our emphasis remains on getting more people vaccinated to receive at least one dose of the COVID vaccine, Dr. Cunningham said. He continued, in Michigan, we have 3 million people who are unvaccinated. The only way for us to get to the other side of the pandemic is for more people to get the immunization or shot, not just to protect themselves, but their children who are not yet eligible for vaccines, other family members, grandparents, friends, and co-workers, and closed quote. Dr. Cunningham, who is a pediatrician, expects vaccines will be available for children between 5 and 11 years old by early to mid-November. Quote, in September, we saw the most pediatric COVID cases nationwide since the pandemic first started. That's because the children are back in school and not wearing masks, and closed quote, Cunningham said. Now the beginning of flu season brings a new twist. Quote, last year we were worried about the twindemic, COVID and influenza, coming at the same time. Because of masking and social distancing, we actually saw virtually no flu activity in Michigan, said Dr. Allison Weinman, infectious disease senior staff physician and system director of antimicrobial stewardship. She expects that to be completely different this year as people are unmasking. Quote, we are already seeing flares of other respiratory viruses such as RSV and lots of other cold viruses, Weinman said. She said the flu shot is safe and effective as well and can be received at the same time as the COVID-19 vaccine. Quote, we're so lucky in the pandemic to now be in a position where we have vaccines. COVID and influenza are vaccine-preventable illnesses, and closed quote, Weinman said. She continued on saying, quote, it would be a great shame to see people in the hospital, which is what we're seeing, who have not received vaccines, and closed quote. All of those articles, including that one from the Oakland Press, are currently posted on our website at civiccentertv.com/coronavirus. Just click on either the picture icon or the headline, and it'll take you directly to the web pages for those publications that have published these articles today, so you can read them in full. And we highly encourage you, if you have the means, to subscribe to these publications as well and support great local journalism that is keeping our communities informed and up to date on all this information, and that is heavily investigating each and every one of these key stories beyond our capacity here at the Megacast as we report on them. We talk to some experts about related topics or things related to some of these stories, but these journalists are doing the really hard work. They're getting down to the nitty-gritty of these details, and we highly encourage you not only to read their articles and direct your traffic to their web pages, but if you have the means, also subscribe. You can also find on our website at civiccentertv.com/coronavirus all of those helpful links about COVID-19 from the Centers for Disease Control and Prevention, the state of Michigan, Oakland County, and more. We have a great Friday edition of the Megacast ahead for you today. Coming up next, I'll be speaking with the CEO of MedNet One Health Solutions in Rochester. Ewa Matuszewski joins me at 10:20. At 10:40, a couple of people will be joining me. Monique Phillips, the CEO of MP Consulting Group and the founder of Detroit Nonprofit Day, as well as Darren Lepick, the director of the Center for Social Entrepreneurship at the University of Detroit Mercy. At 11 o'clock, Ed Terebus, co-owner of Erebus Haunted Attraction in Pontiac, will join me at 11:40. Lauren Williams from M Live will join me. We'll talk about the beginning of the Detroit Pistons season. And then at 11:40, some big issues in Macomb County that are similar to those all throughout the country, with kids participating in dangerous and destructive TikTok trends. We'll be speaking with Macomb County Prosecutor Peter Lucido about how those are being addressed aggressively in Macomb County. All of that coming up next. You're watching and listening to the Megacast.
Whether you're the city,
the county,
or the Huron River Watershed Council.
As partners working together to protect our water resources, we agree.
Pet waste is the source of harmful bacteria in the Huron River.
When it's left on the ground, it can wash into the storm drains.
These lead directly to our streams. No filters, no treatment.
Here's one thing we know that can help keep our water clean.
Pick up pet waste and trash it.
Pick up pet waste and trash it.
So pick up pet waste and trash it.
There's one water, and it's ours to protect.
Who is struggling right now?
I am.
My son is.
Many are struggling with anxiety, depression, and substance use. Before it becomes a crisis, reach out to MyCal, the Michigan Crisis and Access Line, for free confidential support 24/7. Available in the Upper Peninsula and Oakland County. Just call or text 1-844-44-MyCal or chat online at michigan.gov/MyCal. A message from the Michigan Department of Health and Human Services.
I couldn't breathe at all. There was lots of talk about putting me on a ventilator. I thought I was gonna die. I was 39 weeks pregnant and had a scheduled C-section. During that time, I got COVID and was hospitalized for a month. I had a blood clot in my lungs. It caused me to go into right-sided heart failure. I was really scared. I kept texting my husband and my mom, telling them how scared I was, and I was worried that he was gonna grow up without a mom. And then I was worried if, when I did get home, that he wouldn't know who I was. You know, being 27 and a mom and a wife, and having that all almost taken away from me. It's scary, and if a vaccine can prevent that from happening, why not? Get your vaccine. I don't want this to happen to anybody else.
Motorcyclists are hard to see. To keep everyone safer, it's important to always look for them and know where most crashes occur. 84% of motorcycle and vehicle crashes happen on streets, not highways. And most crashes with motorcyclists occur when vehicle drivers are turning left. So before turning, especially to the left, make sure you look for motorcyclists. Then look again. It could save a life.
To Sophia and Gabriel, even though these old knees can't follow on your adventure to the forest today, these flowers represent my love. These stitches and threads join us together. And wherever you see a flower, a bird, a beautiful tree, know that my love is with you.
Make the forest part of your story at a park near you. Find one at discovertheforest.org.
Welcome back to the Megacast. I'm Tyler Keefe, alongside studio producer and board operator Calvin Brown, with us in our studios in West Bloomfield Township, where we broadcast live from 10 a.m. to 12 noon, Monday through Friday, on this, the Megacast. We're also on a number of other television, radio, and web outlets on our live shows and live to tape throughout the afternoon and all over the weekend for replays. To find more information on all those places you can find us and where you can get us on demand as well, go to our website at civiccentertv.com/megacast. Joining us now is Ewa Matuszewski. She is the CEO of MedNet One Health Solutions out of Rochester. MedNet One is a physicians organization serving hundreds of independently owned physician practices, many of those of which are primary care physician practices themselves. And as we continue through this pandemic, there's been so much focus, especially during this recent Delta variant surge, on the impact of COVID-19 on our hospital systems, with COVID-19 also still having a great impact on our primary care providers as well. And Ewa joins us now to talk about some of those issues that our primary care physicians are seeing in their practices. Ewa, thanks for being with us today.
You're welcome. Thank you for inviting me.
And appreciate it. So one of those key problems, and this is what we saw earlier on in the pandemic too, when practices were starting to reopen to non-critical care situations, and we're starting to see more people be able to go back to their primary care physician for those checkups that they missed over the quarantine period of the pandemic. But we're still seeing one of the issues with our primary care practices is that people are still seemingly reluctant to go back in for those routine checkups that are absolutely critical to maintaining their overall health.
So that's very true. And I have to say that we've had a huge opportunity to introduce telehealth services to the community and to the consumer, to the patient. And as we struggled at the very beginning of the pandemic with learning about telehealth activities, and I'm referring to virtual, just like you and I are speaking today, we're beginning to see not necessarily a surge, but an uptick in preventive services being rendered in a telehealth mode. There are so many tools that can be used by a patient, and there are so many ways in which the physician, the primary care physician, and his care team can train and educate patients on using some of those new tools, and that way they can enhance their wellness and their well-being.
We're joined by Ewa Matuszewski. She is the CEO of MedNet One Health Solutions, with us on the Megacast. And so for those that are not comfortable going back into their doctor's offices, are they still able to get those routine checkups that they would normally get in the office at the doctor's practice through telehealth means? Or can they get some of those regular checkups that way and others still need to be in person, or is there kind of a mixed bag there?
So it is a mixed bag. We have several medical directors of groups and even payers such as Blue Cross and Priority that have introduced very innovative ways of doing those annual visits. Our biggest challenge, of course, has to do with access to adequate Wi-Fi. It also has a challenge of training the elderly that perhaps do not feel as comfortable using that type of a tool as they would using, Facebook and other types of tools that are now customarily used by all generations. But I can say this, the way in which waiting rooms have gone through a change is also important. Many of our primary care physicians ask that the patients wait in their vehicles until they are called in to be seen for their visit. So those numbers of individuals sitting in that waiting room have now dramatically undergone a change where people are sitting in their cars, they're able to read their emails, they can listen to music, they can read, and then they do come in to see the physician or the physician assistant or the nurse practitioner, and then they're spending less time waiting, more time doing something that they feel benefits them while they wait.
We're joined by Ewa Matuszewski. She is the CEO of MedNet One Health Solutions out of Rochester. It's a physicians organization that helps independently owned physician practices, particularly our primary care providers and primary care physicians and their practices. Another issue that's coming in the bat now, and this is something we actually talked about in our first segment with our articles today, as we're seeing hospitalizations for COVID-19 on the rise over the last 2 weeks, a 24% increase. There is a growing concern about a twin-demic again this year between COVID-19 and influenza. This was particularly discussed in this article by Dr. Allison Weinman, an infectious disease physician and senior director of antimicrobial stewardship in one of our local health systems, who had said, unlike in the previous year, where we were still social distancing and wearing masks, being that we're mostly unmasked in many places, in many capacities in our regular life today, at this moment in time, and we're not social distancing, we're being more social, we're going back to a lot of the normal activities that we had pre-pandemic, that we are at an increased risk for a greater impact on the flu season. And so primary care physicians also at this moment in time struggling to also get to make sure that their patients are getting their flu shots as well.
So what we've been doing for the last 6-7 months, when the COVID vaccine received emergency use authorization, we began to move our clinics into the community. We began creating pop-up clinics, especially in areas where individuals might be at risk. So we were in downtown Detroit with the NOAA team. We went to St. Andrew Kim, which is a very large Asian community in Farmington Hills. And I have to do a huge shout out here for Oakland County Health Department. They have been so easy to work with. They have supported what we have been doing in the area of doing an outreach or doing outreaches to those communities that most frequently don't have anyone coming to them. So the Asian community, the LGBT community, we come to you and we provide you with vaccines. We provide you with some teaching and training, as a matter of fact, and we try to dispel the myths about vaccines. Our biggest challenge all along has been the ability of providing our primary care physicians with sufficient numbers of vaccines so they can run their own vaccination clinics, as many do during the flu season. A little bit of fear. What do we tell patients? How do we find space for that 15-minute waiting period? How do we prepare for any type of emergency? So there are many moving parts that folks are truly unfamiliar with when it comes to those vaccines. The other thing is, each vial is different. So as we draw those vaccines, and this is something that is not really common knowledge to the general consumer. So when you're looking at the Moderna vaccine, you have 10 doses in that vaccine. And at the very beginning, we wanted to make sure that every single dose got into an arm. Everybody that needed a jab or a shot got it. And we were fearful that we would be opening up a vial, giving one shot, and then basically ruining the rest. Dr. Khaldun was on a call with a group of us and said, if you give one, that means one more person is vaccinated. And we work very diligently within the community and within the at-risk community to make sure that we reduce their fear. We do a lot of educating, and we even provide stickers saying, I've been vaccinated. Best way in which to do PR in the community. Let others know that you've been vaccinated.
We're joined by Ewa Matuszewski. She is the CEO of MedNet One Health Solutions in Rochester, leading an organization that helps serve hundreds of independently owned primary care physician practices in our local area. And another thing that's affecting our primary care physicians, not so much them directly, but mostly their patients or potential patients, is that as we start to come slowly emerging out of the lockdown portions of the pandemic with all the restrictions in place and the other precautions that were in place, we're having less focus on the impact of the social determinants of health, or SDOHs, that are still preventing people from being able to access their primary care physicians or a primary care physician to get those regular checkups, whether that be access to transportation or to technology for telehealth means, or access to healthcare services as well, like health insurance or Medicare or Medicaid, in order to obtain those services. Those are also continuing to be an issue that primary care physicians are seeing at their practices, where they're not able to get some of those other patients back, especially if they've had a lifestyle change, as so many have over the course of the pandemic.
So that's very true, and it's so important for all of us to understand those social determinants. And it's not enough for a physician and a practice team to identify the social determinant. You've got an issue with transportation and I've identified it. Well, then what? It is so important for every physician practice and their practice team to identify resources where they can send individuals for help or arrange for that help to be provided. One of the most important areas that we've been focusing in on is the training of community health workers and also the training of care teams in physician practices. And I really have to put a huge shout out here to Blue Cross, because they have been funding ongoing training through their physician group incentive program to ensure that it's not enough just to say something is wrong, but come up with a solution. And once you've come up with that solution, share it with your colleagues, share it with others. What we at Medical Network One have done, because of gracious funding from several donors, we've actually acquired a couple mobile clinics. Those mobile clinics are not just to go ahead and identify and address medical needs. We have such a demand for mental health services in the community, and we've partnered with the Judson Center and the development centers to begin looking at how we might be able to identify areas where our buses and our behavioral health people can come in and not only address social determinants, but also serve as mini crisis centers, mini SUD, substance use disorder, medication-assisted treatment spots. And those spots are probably those spots are going to drive improvement in access to care, improvement to individuals truly engaging in care services and care activities, and then not having the fear of where do I go to get that treatment? Because it'll come to you. You won't have to go there.
We're joined by Ewa Matuszewski. She is the CEO of MedNet One Health Solutions, located in Rochester. It's a physicians organization. It's helping many of our local primary care physicians practices that are independently owned here in Michigan. And another concern for our primary care physicians is the need for more mental health support services for patients of all different age groups, but particularly for our young patients, for our youth and teen patients who continue to have a really rough go of it because of the COVID-19 pandemic and the changes in their life, which are drastic for anybody in a crisis like this, but especially for people whose bodies and whose minds especially are still developing.
And we are at the forefront with many types of activities in the community. Again, Judson Center is a certified community behavior health organization. We partner with Judson. we provide primary care services, but conversely, we're able to network with groups such as the Salvation Army, such as some religious and community-based entities to ensure that those members or individuals who need immediate care can receive it. And I have to thank Senator Stabenow for being such a huge proponent of that CCBHC model, and the fact that the state of Michigan just recently announced that they will be creating a demonstration project for that particular model of care. Medical Network One and other physician organizations embed behavioral health specialists in primary care. The model is called integrated care. If I, as a physician, come in and notice that you're depressed, I want to be able to not only provide you with an assessment, but I want you to receive that immediate care that you need, and then have someone work with you to structure that next step. That can be provided virtually in a telehealth environment now, so that hand-holding and that guardian angel that people might need, a person might need for behavioral health issues, is available. And again, the need for behavioral health in primary care is crucial. Whether we're looking at suicidal ideation, whether we're looking at just someone to talk about anxiety, especially the young people, it has to be there. So payers also have to restructure the way in which they are reimbursing for these services. And employer groups need to come to the table to figure out a more effective and efficient way so there's parity between mental health and physical health.
We're joined by Ewa Matuszewski, CEO of MedNet One Health Solutions, located in Rochester. Ewa, just another minute or so left with you before we'll say goodbye today. And in the future, we're going to be hearing, as much as we've heard about hospice care in the past, one thing we're going to be hearing a lot more, consumers, particularly healthcare consumers, a buzzword that they'll be hearing going forward is palliative care, and how it's different from hospice care. Give us a little bit of an overview, just briefly, about how palliative care mirrors but also differs from hospice care.
So the big difference is I can enroll anyone into a palliative care program that is in need of chronic illness oversight. We see more and more individuals these days with 4, 5, 6 chronic conditions, and they need someone to help coordinate their care. They have to have someone that can even assist them in the area of legal issues or issues of education. Tell me more about your condition. Tell me how we can help you. Tell me how we can support you. If you have a caregiver and there's caregiver burnout, how do you help that caregiver? How do you bring the family into the picture? That should not be the case in the last 6 months of life. That should be happening at the very beginning, when we need to begin the journey of talking about advanced care planning, developing advanced directives. And I can simply say that many of us just recently put together a curriculum to begin infusing palliative care into primary care as a precursor to, let's say, hospice care. But palliative care can be 1 year, 2 years, 3 years, 5 years. Hospice care, short period of time in preparation for the end of life. So I look forward to sharing more information with your listeners and your viewers on that topic of palliative care and what we all should be focusing in on in the next few years.
Well, Ewa, we appreciate your time giving us some of this insight on what our primary care physicians and their independent practices locally and across the state are thinking about right now, and some of their ongoing concerns as we continue to navigate this pandemic. And appreciate your time and your insight.
Thank you. Have a great day.
You as well. We're going to take a quick break. On the other side, I'll be joined by Monique Phillips. She is the CEO of MP Consulting Group and is also the founder of Detroit Nonprofit Day. We'll talk to her about Detroit Nonprofit Day and more coming up next. You're watching and listening to the Megacast.
Can I ask you a question? Why did you get your kids vaccinated?
It was hard for them to social distance, to be isolated from their friends.
I want them to get back to school and sports games. So as a pediatrician, I recommend the vaccine to everyone I know.
The boys lost a former teammate and classmate who was only 20 years old. It's been a devastating year.
We want to get back to normalcy. Our daughter is really looking forward to being with her friends, being a kid.
It's the Great Lakes water. And so What people do ends up in our waterways.
Flushable wipes are just evil. They should be thrown away. They're impossible to destroy, and they can cause significant problems.
One of the main things when you're cooking is to not dump fats, oils, and greases down your drains.
They stick to the sides of pipes. They stick to everything they come in contact with. Don't put it down the sink.
There's one water, and it's ours to protect.
When times get dark, we can't see the help that's all around us. When you don't know where to turn, let 211 be your guiding light.
How can I help you?
Our guides are ready to connect you with the help you need. For help with food, healthcare, mental health, and other resources, call 211 or visit 211.org. 211. Get connected, get help.
We may come from different organizations,
but we work together to protect the Huron River for everyone.
Neighborhood storm drains carry water directly to local creeks and streams. No filters, no treatment.
Storm drains also help reduce street flooding when it rains.
So clearing storm drains and the areas nearby of trash and leaves helps keep them for rain only.
It is easy to do your part by adopting a storm drain.
Find a storm drain, check it, and clear it every month.
So keep storm drains for rain only.
There's one water, and it's ours to protect.
Welcome back to the Megacast. I'm Tyler Keefe in our studios here in West Bloomfield Township, where we broadcast live from 10 a.m. to 12 noon, Monday through Friday on a number of different community television and radio stations, as well as on the web, all throughout the state of Michigan. Learn more about all of our partners that join us every day for our live shows and throughout the week and the weekend for replays by going to our website at civiccentertv.com/megacast. Joining us now is Monique Phillips. She is the CEO of MP Consulting Group and also is the founder of Detroit Nonprofit Day. Joining us now to talk about Detroit Nonprofit Day. Monique, thanks for being with us today.
Tyler, good morning. Thank you so much for having me. It's great to be here.
Great to have you with us. Tell us a little bit about the background of Detroit Nonprofit Day. When did it start, and how did it come together originally?
Yeah, so Detroit Nonprofit Day was founded in 2018. It was founded as a means of bringing together Detroit's dynamic nonprofit and social enterprise communities together to network and convene in one space for a full day of learning, networking, and skills building. This event, I approached my partner, Bamboo Detroit, Amanda Luan, and also the University of Detroit Mercy, where the event takes place each and every year. So the event, the inaugural event took place in 2018. It was also hosted in 2019, also at the University of Detroit Mercy, who's been a tremendous partner. Darren LePeck from the university, unfortunately, was not able to join us this morning. Due to the pandemic and the nature of this kind of event, the Detroit Nonprofit Day event did not take place in 2020, but we have been, working very hard to put together a phenomenal event for 2021.
And that event will be Saturday, October 30th at the University of Detroit Mercy Center for Social Entrepreneurship, or the CSE. Hours for Detroit Nonprofit Day this year on Saturday, October 30th, 9 a.m. until 5 p.m.
That's right.
So this event began in 2018. It, of course, took last year off. How did the year away from having this event be held in person, being held at all because of the pandemic, how has that impacted the comeback year that is 2021 for Detroit Nonprofit Day?
That's a very good question, Tyler, because we were a little bit nervous as we began to plan the event. So to be honest with you, I was unsure as to whether or not the event would take place this year as well due to the ongoing pandemic. However, due to the persistence of previous attendees of Detroit Nonprofit Day, previous facilitators, previous participants, those who had been involved with the organization in the past, they had a desire for the event to come back. And so, to be honest, we originally scheduled the event to take place earlier in the year, around August or September. But then those dates were not available, thankfully, because we had scheduled the event for October 30th to give, the time for the pandemic to see how it would unravel, to give people more time to be comfortable with being in an in-person space. We have taken every precaution to ensure that there is a COVID-safe environment for everyone. So everyone is required to wear a mask the entire time unless you are eating or drinking, and social distancing will be enforced to the best of our abilities. We do not anticipate a crowd as large as years past due to us having to social distance. However, we do anticipate still roughly 100 to 125 guests being in attendance this year. So we still were very nervous about hosting the event, but thankfully there have not been any more COVID lockdowns or restrictions placed upon us. And so we look forward to bringing everyone together to be able to convene and to share best practices and to, come together to innovate. So we're excited and looking forward to this year's event. Also, we're excited to have September Hargrove, who is a keynote speaker for this year's event, participate. She is the Vice President of Philanthropy and the Detroit Program Officer at JP Morgan Chase, to share her insights with the nonprofit community in terms of what it takes to secure funding and to, to obtain and maintain resilience during this time as you're a nonprofit organization.
We're joined by Monique Phillips. She is the CEO of MP Consulting Group, and she is the founder of Detroit Nonprofit Day, with us today on the Megacast. And especially now, especially given the impact that the pandemic's had on our nonprofit community, the fact that events like this that are so important for outreach to the community from these nonprofits, why is it so important, especially now, or how does it emphasize the importance of these kinds of outreach opportunities for nonprofits now in 2020 versus ever before?
Right. So this year's theme is in recognition of the significant challenges that many nonprofits have had to face in the midst of COVID-19. Many nonprofits, plan their operations and schedule their normal day-to-day activities without a contingency plan in place, without an emergency plan in place. So this year's theme is response, resilience, and recovery in direct response to those, or acknowledgement of the challenges that those nonprofits have faced. Many nonprofits have experienced significant financial challenges, as many of their day-to-day activities involve front-facing events with the public, with the community, as many from the foundation and corporate foundation community have redirected their funding to human service type of funding activities. And so many nonprofits just have suffered tremendously. So as a direct response to that, we have incorporated a pitch competition into this year's event, unlike other year's events, where nonprofits will have an opportunity if they visit the DetroitNonprofitDay.com website, where nonprofits will have an opportunity to enter the pitch competition and register their nonprofit to participate in the competition for an opportunity to win between $5,000 and $7,000. Just for participating, each nonprofit will receive some form of a financial contribution to the organization, as long as they have been in existence for at least 3 years and can demonstrate financial hardship as a direct response of COVID-19. So we're really excited to be able to give back to the community in such a way this year.
We're joined by Monique Phillips, CEO of MP Consulting Group and the founder of Detroit Nonprofit Day, which will be held this year on Saturday, October 30th from 9 a.m. to 5 p.m. at the University of Detroit Mercy Center for Social Entrepreneurship. This one-day event will include workshops, skills training, network opportunities, and a new pitch competition as well. And so there's so much that can be learned right now for these nonprofits from the lessons of the pandemic, of course, from lessons of other nonprofits that have been around and have been working in this space for so many years. Right now, what are some of the tactics and tools that are being discussed through your organization and through other nonprofits to the nonprofit community in terms of leadership and outreach tactics that need to be utilized in order for our nonprofits to come back stronger after such a treacherous and in some cases, really painful pandemic.
Mm-hmm. Right. So unfortunately, we've seen a lot of nonprofits go under just because they could not bear the financial brunt that the pandemic caused for their organization. So since the inception of Detroit Nonprofit Day, we've really tried to focus the core of the program around funding for your organization, because without understanding what it takes to really secure funding for your organization and how to sustain your organization, there are no other parts of your organization that will be able to sustain. So even if you're executive director, even if you're in operations, even if you are an entry-level professional, or whether you are in the idea phase of starting your nonprofit organization, this event is for you. So there are 3 workshops that are offered per theme, but this year, so that would equal 9 workshops. However, this year, to add a deeper level of engagement for our participants, we included a bonus track. So there are a total of 9 workshops that participants can choose from. And so those workshops range in terms of how do you rethink fund development for your organization in the midst of the COVID-19 pandemic? How do you secure corporate sponsorships, whether we were in the midst of a pandemic or not? We definitely always need to understand how to be able to build those relationships with those of the philanthropic community to garner the support that you need. How do we consider different approaches to office space? What's the life cycle of a successful grant? How do you diversify the revenue to sustain your organization for long-term fiscal solvency? Using collaboration for systems change. So how do we utilize our specialties and our special niches in our industries to be able to collaborate with other nonprofit organizations to innovate, to solve problems more effectively, more impactfully. And that's what this event is all about. There's even a workshop on self-care, redefining what self-care looks like for the nonprofit sector, building resources for your mission by partnering with members of the banking community and using debt as a strategic financial tool. So these are just some of the workshops that are available for those who participate with us this year to choose from.
We're joined by Monique Phillips, the CEO of MP Consulting Group and the founder of Detroit Nonprofit Day. And so obviously this Detroit Nonprofit Day has a big impact on these nonprofits, their ability to do community outreach, to have dialogue between them and help each other out with tactics going forward in partnerships, certainly. But it can also be an important outing for people that may attend. So what can people that may attend this event that aren't involved with a nonprofit or are involved with some nonprofits but not others, what can they take from attending Detroit Nonprofit Day on October 30th?
So predominantly, if you are in the social impact sector as a whole, this event can be for you. There are learnings and takeaways from this event that are transferable to other industries as well, in the business community as well, particularly because this event is housed within the University of Detroit Mercy's School of Business within their Center for Social Entrepreneurship. So if you care deeply about making a big impact socially, if you have a social enterprise organization, or if you just care about, gaining different skills, tools, and tactics, for your own knowledge base, this event is definitely for you.
We're joined by Monique Phillips. She is the CEO of MP Consulting Group and the founder of Detroit Nonprofit Day, which will be happening on Saturday, October 30th at the University of Detroit Mercy Center for Social Entrepreneurship from 9 a.m. until 5 p.m. Monique, is there a cost to attend this event for the public?
There is a cost to attend the event, just because that there are costs associated with putting the event on. The general admission cost is $150 for a participant, or $99 if you are a student. However, tickets are on sale currently for $80. So that's a whopping $70 off of the general admission ticket. So we're really excited to offer that discount to be able to, encourage greater participation and ensure that, it's inclusive to everyone who wants to be a part of this great learning day.
Well, Monique, we appreciate your time telling us all about Detroit Nonprofit Day, how the public can participate, why it's so important for our nonprofits in this year, on top of all the past years that it's been running since it was debuted in 2018. Before we let you go, just another couple minutes, anything else that would be important for our audience to know, for our nonprofits to know that may be participating, or something interesting for them to keep an eye out for as we approach Saturday, October 30th, when this event will be held at the University of Detroit Mercy's Center for Social Entrepreneurship?
Yes. So first of all, your listeners can visit www.detroitnonprofitday.com for a complete rundown of the day's activities. So on the website, you can click on the link to enter the pitch competition, which the pitch competition will probably be open for another day or two before we close it down to give those who have entered an opportunity to prepare for the pitch. You can learn about the different workshops that are being offered. We are offering breakfast, lunch with the ticket, as well as free parking. And so there is also a special lunch presentation where we will honor the Executive Director of M&A, Donna Murray Brown, as she moves on to the next chapter of her life. So we are going to recognize the impact that she has made to the nonprofit community over the past several decades in the city of Detroit. And so that is going to be a phenomenal experience as well. So throughout the entire day, we know it's a long day, 9 a.m. to 5 p.m., but there is so much excitement throughout the entire day. It's such a fun event, and organizations really do enjoy the opportunity to connect with others that are in their space and others that are not in their space. To me, that's the most impactful and powerful moments of the event. So we just look forward to seeing everyone out there. Like I said, tickets are on sale up until Sunday, October 24th. And so we just look forward to seeing everyone there. So thank you again for having me, Tyler.
Yeah, thank you for coming on. There are so many great nonprofits in Detroit and in the metropolitan area that will be participating in this event. There's a lot for people to learn between nonprofits and about all these nonprofits and how they can assist them as well. And it's important for these organizations that are doing great work all across the state of Michigan, all across southeastern Michigan and in Detroit and the metro area especially, to have this outreach, especially now after a really tough year in the pandemic. So I appreciate you for holding this event and for telling us more about it. Thanks, Monique.
No problem. Thank you, Tyler.
Monique Phillips, the CEO of MP Consulting Group and the founder of Detroit Nonprofit Day. Again, that event happening on Saturday, October 30th at the University of Detroit Mercy's Center for Social Entrepreneurship, 9 a.m. until 5 p.m. Learn more about everything happening at the event, all the vendors, all the different workshops, how you can get tickets, register for the event, and purchase your tickets at the currently discounted rate, as Monique mentioned, by going to their website at DetroitNonprofitDay.com. We're going to take a quick break. On the other side, we'll continue with the second hour of our show on your radio homes for the Megacast, 89.3 WBLD Orchard Lake, West Bloomfield, Keagle Harbor, Sylvan Lake, and 88.1 WBFH Bloomfield Hills. Coming up next is Ed Terebus, the co-owner of Erebus Haunted Attraction in Pontiac, as they get ready for their busiest time of the year as we are quickly approaching Halloween. That is coming up next and more. You're watching and listening to the Megacast.
We as Michiganders feel connected to this resource in a way that I think is really powerful.
Conservation starts with a caring, committed community.
For me, it's peaceful to have a relationship with the river.
Every single one of us has a role to make sure that those waterways stay safe and healthy, being careful about what goes down the storm drain.
Just even eliminating some of your single-use plastic makes a difference.
There's one water, and it's ours to protect.
People are getting out to walk and bike in higher numbers. More vulnerable road users and higher speed traffic can be a dangerous combination. Crash severity has increased, so if you're driving, be sure to slow down and look for people. There's no need to speed. If you're biking, ride with traffic. If you're walking, avoid stepping into the road if possible. If you have to walk in the street, walk facing traffic. Learn more at walkbikedrivesafe.org.
When times get dark, we can't see the help that's all around us. When you don't know where to turn, let 211 be your guiding light.
How can I help you?
Our guides are ready to connect you with the help you need. For help with food, healthcare, mental health, and other resources, call 211 or visit 211.org. 211. Get connected, get help.
Parents do a lot of worrying. Get your kids caught up on childhood vaccines to protect them from these 14 preventable diseases, and you'll have 14 fewer things to worry about. Vaccines are safe and effective and save lives. So let's get caught up on vaccines and worry about something else. Get the facts at ivaccinate.org.
We may come from different organizations,
but we work together to protect the Huron River for everyone.
Most of the pollution that goes into our rivers is carried by rainwater that flows off of roads, parking lots, and rooftops.
The leaves and bark of a single tree can retain a surprising amount of rainwater. Depending on its size and species, it could be 100 gallons or more.
It is estimated that an urban forest can reduce annual runoff by up to 7%.
Here's one thing that we know can help keep our water clean.
Plant a tree.
Plant a tree.
Plant a tree.
There's one water, and it's ours to protect.
Welcome back to the Megacast. I'm Tyler Keefe alongside Calvin Brown in our studios here in West Bloomfield Township, where we broadcast live from 10 a.m. to 12 noon, Monday through Friday, all across the state of Michigan on a number of different television, radio, and web outlets. Learn more information and find all of our full episodes and individual interviews on demand on civiccentertv.com, and just click on the Megacast link. Well, Halloween is just a little bit over a week away, and everybody that is out there looking for a spooky experience before they celebrate the occasion, or as they celebrate the occasion, they're going to be looking for haunted houses, haunted experiences all throughout the state of Michigan, and there's very few places, if any, that can match that experience of Erebus Haunted Attraction in Pontiac. And we are joined now by Ed Terebus, owner of Erebus, with us on the Megacast. Ed, thanks for being with us today.
Thanks for having me on the show.
Appreciate having you back. So you got you got quite the history over there at Erebus. It is very well known here in southeastern Michigan, certainly in Oakland County, as a big attraction during the Halloween season. This year, what should people be expecting as they go to Erebus, especially seeing that things are a little bit more open up now and are significantly safer than they were a year ago, although still with precautions necessary? What can people expect when they go to Erebus during this Halloween season?
You know what? It's still, Erebus is still a half-mile walk inside the building. We did shut down a couple things that were, in contact with the people, or a big group of people we needed in one big room, so we eliminated that. But we still we added a couple new sections. We have a invasion of Area 51, and then we also have Miss Patty's meat pies. So you can actually see how we make the meat pies in the basement of Erebus, and then you can come upstairs and actually enjoy one. So we actually sell them at the concession stand also.
We're joined by Ed Terebus. He is the co-owner of Erebus Haunted Attraction in Pontiac, joining us on the Megacast. And Ed, there are so many different haunted attractions and experiences, whether it be haunted corn mazes or haunted houses that pop up, or haunted attractions such as Erebus in many places across the state of Michigan. What makes Erebus stand out from these other places and make it such a significant and impactful experience for people during the Halloween season?
Well, all the haunted attractions are cool. That's kind of like your graduation from trick-or-treating. The next step for Halloween is go to a haunted house or a haunted attraction somewhere. The reason we stick out a little bit is there's been so many haunted attractions in southeast Michigan over the years. I mean, at one point, we had 100 attractions within 50 miles of us. And when we went to the trade show, we couldn't buy that really cool something because 25 other guys would have it. So when you come to Erebus, you're going to see a lot of unique things you don't see at other haunted houses, because we created them here. We try to be unique. We're known as a very unique haunted house, different than other haunts.
We're joined by Ed Terebus, co-owner of Erebus Haunted Attraction, joining us on the Megacast. And Ed, as we continue on to dealing with COVID-19, there's still many precautions that are being taken by several different businesses and organizations all throughout the local area. It varies industry to industry, place to place. Given that this is a mostly indoor experience where people will be gathering in groups or even just individually to go through this haunted attraction, what precautions should people be aware of that may be in place at Erebus this year as they go to the haunted attraction?
Well, you know what? We're not forcing people to wear a mask. We recommend it, but that's the customer's option on that one. And again, the close contact thing. We're actually when you're going through the haunted house, you're walking by my actors in 7 seconds. I mean, it's actually a quick process. We have people hired throughout the place, wiping things down. We have sanitation stations. A lot of things that were in place last year are still in place with a few modifications. Last year, we had 0 breakouts, for the whole season.
We're joined by Ed Terebus, co-owner of Erebus Haunted Attraction, located in Pontiac. That is on 18 South Perry Street in Pontiac, Michigan. And Ed, is the attraction open? When is the attraction open to the public? What are your hours that people can pick and choose from to experience this haunted tradition here in southeastern Michigan?
We're open right now. We're open every day till Halloween, and then we're going to be also open November 5th and 6th, that Friday and Saturday. Weekday hours are 7:30 to 10:30, Friday and Saturday hours from 6 p.m. to 1 a.m., and Sunday hours are 6 p.m. to 11 p.m.
We're joined by Ed Terebus, co-owner of Erebus Haunted Attraction in Pontiac, joining us on the Megacast. You're also associated with the upcoming Oddities Museum as well, and you mentioned a little bit of that earlier on. What is this museum, and how is Erebus connected to this other new attraction?
It's a separate entity altogether. It's called Mythos. It will be opening hopefully by the end of this year. Great oddities from dinosaur bones to mortician stuff to 450 vintage Halloween masks. It's a very cool thing. It'll probably be open year round, but it's located right downtown Pontiac, right next to Erebus. It's called Mythos.
We're joined by Ed Terebus. He is the co-owner of Erebus Haunted Attraction in Pontiac, joining us on the Megacast. You can learn more information about Erebus by going to hauntedpontiac.com, where you can learn more about the haunted attraction, get tickets, find special offers, follow them on their social media, and more. Again, that is hauntedpontiac.com. And in addition to the haunted attraction, there's more that is going on at Erebus. You mentioned earlier some of the attractions that are throughout the building, but also want to talk to you about the Erebus Escape Room. Is that currently in operation now, and what can people expect when they participate in the escape room?
Erebus Escape is also open year-round. It's kind of like we took the escape room experience, and if you ever saw a movie Total Recall, where they implant memories in your head about going on vacation, and they said, but why just be you on vacation when you could be a secret agent? We're kind of taking that philosophy. Why just play an escape room when you could be a escape artist and get out of prison? You could be a top cop, solve the crime. You could be Indiana Jones and find the Temple of Doom. So that's our philosophy. So we actually have some highly themed rooms. They're very cool, very interactive. We call that Erebus fun without the fear. You're in there all by yourself. A couple of them are creepy, but nothing super scary.
We're joined by Ed Terebus. He is the co-owner of Erebus Haunted Attraction, located in Pontiac, joining us on the Megacast. It is currently open to the public. You can get your tickets on their website at hauntedpontiac.com. Just click on their get tickets option, and then you have options for Speed Pass, VIP tickets, group rates, and more. Again, you can learn that and find out all their schedules for October through Halloween, again, at their website, hauntedpontiac.com. .com. And so, Ed, as you're planning for this event every year, it's not the same thing every year, especially the haunted attraction. It's always something different. Coming into this year, knowing that there would be more people likely that would be coming out to the haunted attraction as things are opening back up following the thick of things in the pandemic, what sort of planning went into this year's event, and what was the focus as you were planning the haunted attraction for 2021?
We're always planning new things. We change approximately 20-25% of the show every year. We can't change all of it because, like I said, it's a half-mile walk through the building. We also were anticipating COVID things. Again, we eliminated a couple items that would actually, touch you and get in your face, and we didn't want people to. Sorry about that.
That's okay.
And then we also have.
How are you?
Just regular stuff that.
We're having just a little bit of technical issues with Ed. Ed, it sounds like we have you back again. So please continue on.
Yes. Again, we eliminated some of the things that were in could be COVID sensitive, so we eliminated that kind of stuff. But we also came up with other things, new things. Again, the alien section, the meat pie section. Very cool, response, been great with it. So and again, we're always playing back and forth and keeping things safe, sane, in a fun environment. Haunted houses are just not scary, but they're also fun. I mean, you go, if you can't be scared, you're going to have fun watching your friends be scared.
Absolutely. We are joined by Ed Terebus, the co-owner of Erebus Haunted Attraction in Pontiac. Again, that is located on 18 South Perry Street in Pontiac. Learn more information on hauntedpontiac.org. And Ed, what's exciting about this haunted attraction is it's not just a tradition. It's not just something that people look forward to and travel to from here in the state of Michigan. You actually have people that are looking forward to Erebus Haunted Attraction and are joining you from all across the state and across the country as well.
We've had people come internationally to come see what we do here. Again, we're very unique. We got things that you won't see other places. Unfortunately, Buried Alive's not working, but we got the swamp, the bottomless pit, spike spindle. I mean, all these other things that are very unique over here.
We're joined by Ed Terebus, co-owner of Erebus Haunted Attraction. They are currently open through Halloween for their regular season at the Haunted Attraction, a half-mile indoor walk through one of the world's largest haunted attractions. Ed, just another few minutes with you today before we'll say goodbye. Anything else that would be interesting for our audience to know about this year's haunted attraction or any other events going on or attractions going on at Erebus at this time?
You know what? I think you kind of covered all of it. We have anything from insane clowns to the guys in the basement to crazy truck drivers. We got again, the butchers downstairs in the meat shop. We got the aliens. We got the victims of the aliens upstairs. We also have the escape rooms going on. We got a couple new ones in the escape rooms. It's a Harry Potter type room. And we also have one that's kind of like a fairy tale, which are great for families and kids.
Well, Ed, we appreciate it. Thanks for joining us to tell us what people can expect when they go out to Erebus this Halloween season. And, of course, they can always learn more on your website. Thank you for joining us.
Thank you for having me, and happy Halloween.
Yeah, you as well. Again, you can learn more about everything going on over at Erebus, including their haunted attraction, purchase tickets, learn more information, and learn their schedule as well by going to their website, hauntedpontiac.com. Again, that is hauntedpontiac.com. We're going to take a quick break. On the other side of the break, we will transition from the Halloween season to the basketball season. I'll be joined by Lauren Williams. She is a Pistons beat writer with MLive.com as the Pistons begin their season. Some exciting changes over the summer, most notably the Pistons acquiring the #1 overall pick and selecting Cade Cunningham out of Oklahoma State. But still some concerns with the team going forward as they're rebuilding. We'll discuss that and more with Lauren coming up. You're watching and listening to the Megacast.
One of the things you can look for in your friends is a change in behavior.
These can be big changes, they can be small changes in mood,
physical appearance. They may be sleeping less or sleeping more, drinking more, or their eating patterns may be different.
One big change that can be pretty obvious is change in motivation. Do they no longer want to play basketball? Do they no longer want to play video games?
Now that we're spending more time online and in virtual settings, it's really important to pay attention to the language that your friend is using and the words they're using to communicate.
So when we text our friends, are they taking longer amounts of time to respond? Are they not responding at all? You don't have to be an expert to try to recognize these signs. The second that you feel it in your gut and that you're concerned, that's the second to have the conversation and open the door to what might be going on.
Today, it is easier than ever to join Michigan's Organ Donor Registry and help build a bridge of hope for organ, tissue, and eye donation. Just one person can potentially save or help improve the lives of up to 75 people. By joining, your legacy could be the gift of life. Sign up today at michigan.gov/SOS or at any of the more than 145 Secretary of State self-service stations located across Michigan. Be part of Michigan's Bridge of Hope by adding your name to the Organ Donor Registry.
When times get dark, we can't see the help that's all around us. When you don't know where to turn, let 211 be your guiding light.
How can I help you?
Our guides are ready to connect you with the help you need. For help with food, healthcare, mental health, and other resources, call 211 or visit 211.org. 211. Get connected, get help.
How does marijuana affect the teen brain?
Our brains are still developing into our 20s.
With regular use, marijuana can affect teen brain development.
It can affect our brain's circuitry and blood flow and impair thinking, learning, and memory function,
which could hold us back from reaching our potential.
Don't let marijuana mess with your brain.
Get the facts at michigan.gov/drug-free.
Whether you're the city,
the county,
or the Huron River Watershed Council,
we work together to protect water resources for everyone.
Most of the pollution entering our rivers is carried by rainwater that runs off roads, parking lots, and rooftops.
A rain garden helps catch stormwater runoff.
Rain gardens and their plants help dirty runoff soak into the ground.
You can do your part to help keep our water clean.
Learn about rain gardens and native plants.
So consider a rain garden in your home landscaping.
Catch the runoff with a rain garden.
There's one water, and it's ours to protect.
Welcome back to the Megacast. I'm Tyler Keefe alongside Calvin Brown in our studios in West Bloomfield Township. We broadcast live from 10 a.m. to 12 noon, Monday through Friday, here on the Megacast on a number of community television, radio, and other media outlets. Learn more about everywhere that we broadcast and find us on demand on our website at civiccentertv.com. Just click on our Megacast link or type in civiccentertv.com/Megacast. Joining us now is Lauren Williams. She is a Pistons beat writer with MLive Media Group and also covers the Detroit Tigers and the Detroit Lions. Lauren, thanks for being with us today.
Thank you so much for having me.
Appreciate it. So the Pistons have kicked off their season. Of course, it began a few days ago with a loss, 94-88 loss to the Chicago Bulls, an in-division rival. Pretty decent play across the board from the Pistons, even despite missing their new young star, #1 overall pick, Cade Cunningham, out with an injury, and we'll talk about that more. But from what we've seen so far from the Pistons, how different is this team this year in terms of their performance? And it's tough to say after one game versus where they were at the end of last season.
You know, I think this Pistons team is a little bit similar to the team that they had last year. They didn't have a lot of turnover in the roster, which was a very important thing for Troy Weaver coming out of last season. He wanted to double down on the restoration and, you know, that development he thought needed to take place in-house versus going out and getting some new free agents. I mean, they added just 2 last year, and they put a lot of focus on re-signing a lot of the restricted free agents that they had in Hamidou Diallo, Frank Jackson, and Sabin Lee. So the fact that they have a lot of carryover from the season before means that we're going to get a team that has a lot of intensity, that's going to fight every night. You know, that's something that's important to Dwayne Casey and Troy Weaver, is building a competitive culture that's going to compete night in and night out.
And both of those guys, Dwayne Casey and Troy Weaver, they've been part of this kind of a rebuild, or this sort of a rebuild in the past. Dwayne Casey with the rebuild of the Toronto Raptors, who eventually, after he was dismissed from that job, did go on to win an NBA championship. And then Troy Weaver, who was played a key role in the front office under Sam Presti in Oklahoma City. They've done this gradual rebuild, really investing in these young guys, knowing that the teams are not going to be very good on paper, but are going to develop really quickly, and then you're going to have eventually that boom when those guys do hit their stride and you bring additional people in. Really investing in the youth of this team, like you mentioned, many of those restricted free agents that they brought back, guys like Sabin Lee, guys like Hamidou Diallo, also some of the veteran guys that are still pretty young, like Josh Jackson, who so far has had a pretty good showing between the preseason and the regular season. One area of concern, however, for a lot of the fan base, and we hear it from a lot of the pundits as well, is the play of Killian Hayes. He's in his second season. He's only played at this point in his career 27 games, but his jump shot and his ball movement has been a little bit of an issue so far. In terms of the front office of the Pistons, being that they have shipped off some of their other younger guys who were still in the infancy of their career, guys particularly like Sekou Doumbouya, where is that front office at in terms of what they think about this young player in Killian Hayes, especially now when you have a ball-dominant point guard, combo guard really, in Cade Cunningham coming in?
I think with Killian, you know, he has a lot of support inside that organization because they want the best for him. You know, they took him 7th overall last season, so they're not going to give up on him just yet. And one of the things with Dwayne Casey is he is stressing how much patience we need to have with the development of Killian Hayes. As you mentioned, he's only played 27 games so far in his young career, and the fact that last season he was unable to kind of string together enough games to kind of get that momentum, play through the mistakes that a lot of young rookies get a chance to do. I think that's a big deal. He's still trying to figure things out, and with a lot of young point guards, it's not going to happen overnight. Dwayne Casey likes to point to Fred VanVleet as somebody who, you know, we can look to seeing that trajectory of development as something for Killian Hayes to fight through. You know, again, it's not going to happen overnight. That jump shot, it's not going to happen overnight. So I think the message that's coming out of the front office right now in regards to Killian Hayes is patience. And that's something that Killian Hayes has internalized. You know, he knows what everybody's saying about him. He's very much aware. And he said that right now he's just focused on playing his game and making sure that he has a good mindset every time he steps foot on the court.
Yeah, and even on top of that, you are one game into the season. He's back. He's healthy. He hasn't really played in full competitive game action. Of course, he's played in the preseason, had some summer league action previously, but not quite at this full NBA level against a team that's going to be a formidable opponent this year in the Chicago Bulls. And you look at other guys that did come in to the league with a little bit more experience, like Tyrese Halliburton, who was drafted after him by the Sacramento Kings, and even look back at like you said, Fred VanVleet during his development with the Toronto Raptors, came in with a lot more experience already than Killian Hayes, who's just 20 years old. We're joined by Lauren Williams. She is a Pistons beat writer with MLive.com, joining us on the Megacast. One of the surprises so far for the Pistons, it's been a really really pleasant surprise and a great story on this team has been Luka Garza, who was drafted in the second round by the Pistons out of Iowa. Had a prolific season in his senior year at the University of Iowa. Of course, his size size not an issue. It's really just whether or not his style of play translates to the NBA. But the Pistons have gone from bringing him in for the summer league to signing him to a two-way contract to a fully guaranteed contract in pretty short succession. What ultimately has led Troy Weaver, Dwayne Casey, and that Pistons organization to go head on in investing in this second-round pick before he's played in regular season action?
I think Garza kind of embodies the culture that they're trying to build with this team as part of this restoration. He has a lot of hustle. He said it best, actually, at the end of Summer League, or I believe it might have been the second to last game of Summer League, that he might not necessarily be the best defender on the court or the fastest, but he's going to try and out-hustle you. And the fact that he's one of those people that can be first in the gym, last out of the gym, they want to invest in guys who are constantly aiming to get better. And the fact that he can shoot is a plus. That was something that the team really, really wanted to bring in, is people who can shoot the ball, because that's something that they struggled with last season. They struggled with it in the first game of this season. So he has a lot of qualities that they like, and it's an indictment of the confidence in him that they have to upgrade his contract from that two-way to the standard contract. With the bench or with the roster that they have right now, he's not going to get a lot of playing time. Dwayne Casey wants to keep the roster to about 10 players a game in the rotation. So he's going to spend a lot of time in the G League with the Motor City Cruise, which was a really big reason that, they stressed getting the Motor City Cruise into Detroit. They wanted to be able to have that outlet that players can go back and forth easily to play lots of games, especially when they won't get lots of minutes on game night, so that they can continue their development. And there's constant communication between that coaching staff, that front office, and the main team.
Yeah, get that experience in gameplay scenarios, especially as a primary player, a starter caliber player in the G League, but still get that communication and development from guys with similar styles of play, like a Jeremy Grant. Certainly got someone like Kelly Olynyk on the roster, and Trey Lyles, who have that game experience as well, and he can learn from that. We're joined by Lauren Williams, Pistons beat writer at MLive.com, also a beat writer for the Detroit Tigers and the Detroit Lions with MLive as well. And one big concern right now for Pistons fans is Cade Cunningham and his injury. He's out with an ankle sprain. He did not play in the preseason, and the Pistons have been very careful in determining when he is going to get that first game action. We've seen him in shoot around. We've seen him in warm-ups and playing in practice scenarios. Seems to be looking good. What is the current outlook for Cade Cunningham, and what is that benchmark that the Pistons are looking at right now for determining when he'll be back?
Yeah, they keep saying that he's day-to-day right now, which we understand just because of the nature of ankle injuries. Troy Weaver said on the Stoney and Jansen show a couple of days ago that they don't anticipate him being back in this upcoming 3-game road trip that they have. So their next home game is on October 30th against the Orlando Magic. And, if he does make his debut that day, by that point, he should have had at least a week's worth of practice before they, go ahead and put him out on the floor. So during the preseason, one of the key things that Dwayne Casey kept saying is that he really wanted to get him a couple of practices under his belt before, he started in a game. So if we're following that timeline where he's, slowly been getting back into practice, maybe we could see him on the 30th. Maybe they'll wait a little bit longer. We'll see. But they definitely want to get him up and conditioned and, ready to go before they throw him out there.
Yeah, and those sprained ankle injuries, there's something that you can play through, that they can play with and tend to while in game action. But they're also really easy to re-injure, and it's really easy to exacerbate those injuries as well, and especially for a ball-dominant guard that plays at a high pace like Cade Cunningham, that can quickly become really dangerous. And when you're investing in a player like Cade Cunningham as the future of your franchise, there's really no harm and no foul in keeping them back for a little bit. We're joined by Lauren Williams, Pistons beat writer with MLive.com. And in terms of fan experience, we are back in full capacity, being allowed at Little Caesars Arena for fans. What precautions are in place if people are excited to go see the Detroit Pistons with this new look with Cade Cunningham? What current precautions are in place for Pistons games at Little Caesars Arena?
Yeah, so fans that are actually right by the court, so they're sitting courtside or they're by the players' bench or anything like that, they do ask that they are either fully vaccinated or they can provide a negative test, within, I believe, 24 to 48 hours of the game, whether that's a screenshot or bringing the actual cards in. They want to be able to say that you're safe. On top of that, they do ask people who are close to the court to wear masks, but most of the fans in the general seating arena or area haven't been wearing masks because it's not a requirement. So, you just have to kind of use your own judgment on what you think is best if you're sitting in the general admission area.
We're joined by Lauren Williams, Pistons beat writer at MLive.com. And also on the fan experience front, there's been a lot of changes at Little Caesars Arena for Pistons games in particular coming up this year. Of course, they redesigned their court floor. They have, of course, a somewhat new look team, but a lot of similar guys that are back, but also other really interesting elements that they've added to the fan experience. What are some of those, and what went into the decision to enhance some of those fan experiences coming into this season, especially with it still being very much a rebuild situation here in Detroit?
They're really, really interested in, especially since moving Little Caesars, or since moving the main competition area, the arena, they're really interested in connecting to their Detroit roots. So they've been tapping into local celebrities. At the home opener, there were several local rappers that attended. Cash Doll, I Swear Vezo, Babyface Ray was the halftime performer. So it's just kind of a rollover from last season where they really tried to bring local Detroit influencers into the space that fans could connect with, and who could help get the word out about this new look Pistons that they're really trying to promote. One of the things that Troy Weaver talked about is that he wanted to create a team and an arena and an atmosphere that Detroit would be proud of and Detroit Pistons fans would be proud of. So it's really been a big deal that they've tapped into local celebrities who can help get the word out about what they're doing.
And a lot of that has also been participation from Pistons legends. We saw on opening night, Richard Hamilton was there for some meet and greet purposes. Ben Wallace is now a part of the front office in some capacities as well. We've seen Isaiah Thomas be back in some capacity, joining in with organizationally with promotional events as well. And being that's the NBA's 75th anniversary season, there's already a lot of promotional actions that are happening across the league, including some controversy last night with the final 25 players revealed on the NBA's top 75 players team. In terms of the Detroit Pistons franchise, do they have any plans as of now further going forward in the works of how they plan to celebrate the NBA's 75th season at Little Caesars Arena with the home games?
I personally haven't heard anything yet, but I can't imagine that they wouldn't want to tap into the fact that they had at least 6 players who ended up on that list. We saw that they had Dave Bang. We saw that they had Isaiah Thomas. We saw that they had, Allen Iverson, who I know was only on the team for, 54 games.
That counts.
The fact it still counts, exactly. But the fact that the Pistons organization, this franchise, has left such a lasting mark on the NBA, they're going to want to tap into those roots, the past. And that's something that's been very important to Troy Weaver when he's been constructing this roster, is to make sure that he's getting elements of what the past championship teams have done and putting it into the modern day NBA. So we've heard the jokes about how much he likes centers and big men and everything like that. We've heard how much he liked the physicality of the bad boys. So I definitely don't see how they wouldn't want to try and, put those influences in the fan experience for this season and moving forward.
We're joined by Lauren Williams, Pistons beat writer with MLive.com. You can read all of her articles by going to MLive.com/Pistons, where you can read her articles after the games of other stories that pop up throughout the season for the Pistons and more. Again, MLive.com/Pistons. And Lauren, previously you had worked for the New England Patriots as an editorial coordinator. Now you're also covering the Detroit Lions. You're covering the Lions, the Pistons, and the Tigers, all teams that are in the thick of their rebuilds, coming from a team that had such a winning culture in New England. How drastic of a change has that been, coming to Detroit now and covering three teams that are in similar positions but also at different stages of their rebuilds?
You know, I think what made this transition easier is just the loyalty and the dedication that the fans have to this team. It's very, very similar to, you know, how dedicated New England fans are to theirs, you know, between the Red Sox and the Celtics and the Pats and everything like that. So, you know, the fan loyalty does help because it helps me think about the stories that they want to read about and what they're interested in. But in terms of covering the teams, it's definitely a night and day difference of covering a team that, as you mentioned, had a culture of winning. They have, you know, so many Super Bowl wins under their belt. So it's definitely a difference, but the fans make up for it for sure.
Well, Lauren, we appreciate you joining us, telling us a little bit about the Pistons coming into this season and as they begin this season, still in the rebuild, but with a clear direction ahead of them. And we'll continue to learn more about them through your articles as well on MLive.com/Pistons. Thank you.
Thank you.
Appreciate it. Again, you can read Lauren's articles on MLive's website by going to MLive.com/Pistons, and there to list all the articles about the Detroit Pistons from Lauren and from others at MLive Media Group. We're going to take one more break, and when we come back, I'll be talking with Macomb County Prosecutor Peter Lucido about ongoing TikTok trends that are becoming a very big problem in many of our schools, and the Macomb County Prosecutor's Office is taking those issues very seriously. Parents, students, you're going to want to listen to this interview coming up next on the Megacast.
A message from the staff of Michigan's Crime Victim Compensation Program.
Anyone can be a victim of crime
and suffer lasting trauma, physically, emotionally, and financially.
But you are not alone.
If you're struggling financially due to a crime,
we're here
for you. Find out if you qualify for crime victim compensation. Call 877-251-7373 or visit michigan.gov/crime-victim.
A message from the Michigan Department of Health and Human Services, Division of Victim Services.
You see certain things get reincarnated in your children. My daughter is very much inspired by my wife's artistic pursuits. So my daughter started making necklaces. She makes what we call affirmation fashion. I tell her every day that your black is beautiful. Your black is beautiful. Your black is beautiful. And if there's anything better than being beautiful, it's being smart. And if there's anything better than being smart, it's being kind. And reaffirming that every day is our method of making sure her chin never drops. My dad wasn't around, and I remember riding a bike and falling off and cutting myself, and me never just wanting to get back on it. People ask, how your children learn how to ride a bike, and you did. I didn't teach them. I just created an environment where they taught themselves, and all I had to do was be there.
To begin today's show, we're pleased to be joined now by Pete Lucido. He is the Macomb County Prosecutor, joining us now on the Megacast. Prosecutor, thanks for being with us today.
And good morning to listeners.
Good morning to you as well. So some concerning things happening in our schools as of late, some new social media trends, particularly on TikTok, trends such as the devious licks trend, which had been really coming into the limelight late last month, where kids were stealing affects from the school or damaging property of the schools while in the school to try to get trending on the social media. And we also have some additional new concerns now and new trends, particularly one where this month the challenge is to slap a teacher. This is something that's being particularly focused on in your department up there at the Macomb County Prosecutor's Office. How is that being addressed, and just how seriously does the Macomb County Prosecutor's Office take these offenses among children?
Well, first of all, they call it the TikTok challenges, and I don't know who came up with it, but it's wrong, and it's against the law if you're going to do something that is illegal. So, number one, we have to look at our school district. We have a very large school district here in Macomb County. Between the ISD and the rest of them, we're the largest school district other than Detroit. And as a result, we've got to be very vigilant. We've told the teachers we stand shoulder to shoulder, toe to toe with them. We will not allow this to happen. We told the school administrators that it is a zero tolerance policy in the Macomb County Prosecutor's Office as it relates to destruction of private property, because this is public property, our schools. Our public schools are public property, and it takes away from all taxpayers and families, and it shouldn't be that way. We should be using it in the classroom to educate and to grow the minds of the individuals instead of showing that criminal activity is acceptable. So what we've decided to do is we put out a press release. We put out a press in my advisory showing that we have a zero tolerance policy when it comes to crime. And I know that the schools have their own internal policies as it relates to the student handbook. Parents, be vigilant to explain to your child, and these are children because they're under the age of 18 in these high schools. When they turn 18, then they become an adult now in the eyes of the law, because raise the age just was passed into law, and it started October 1st. So if you're 18, you're charged as an adult. Now 17, you're charged as a juvenile. However, if the crime is heinous enough, we're going to wave you up and try as an adult. We're giving you notice out there, everybody. You commit the crime of the TikTok challenge and slap a teacher, hit him in the head, hit him anywhere on their body, it's assault. It could rise to aggravated assault. It could rise to something otherwise if you have something considered a weapon in your hand. You destroy any school property, be on the lookout, because we're coming for you and we'll prosecute you. The student handbook can say you can be expelled. And remember one thing, the students that are listening, the parents, they can forfeit their right to go to a university and a community college because of the actions that were taken in their high school. They could also forfeit the possibility of getting student loans and aid necessary to facilitate their finances. Don't do it, is my statement. Don't do it.
We're joined by Macomb County Prosecutor Peter Lucido with us on the Megacast, particularly addressing at this moment in time TikTok challenges such as the TikTok challenge and devious licks. In one scenario, both are severe, but one is much more severe than the other. In the case of devious licks, it is destruction of property, and as you said, it is destruction of public property. It's entirely unnecessary. It's not worth it. They're doing it for attention of people that, frankly, don't care about their best interests anyway. And then in the case of the latest TikTok challenge, the where they're slapping a teacher, that is assault. It is a very serious crime, and it is something that's going to be taken incredibly serious, as you said, a zero tolerance policy in Macomb County. In terms of the parents, as they're having these conversations, or they're preparing themselves to have these conversations with their kids, in the case of kids that are under 18, that are minors, how liable are parents in these situations for the damage to the public property in the school, but also, even on top of that, potentially liable for the actions of their children in regards to assaulting their teachers with these challenges?
I can tell you this, the Lucido family has been in the insurance industry for 4 generations. Any intentional act taken by a minor and or an adult is not going to be taken care of by your insurance. There's no insurance that says you can go out and commit a crime and we'll pay for it. And as a result, the parents are absolutely liable for the actions of their children up till their age 18. And at that time, if the child is in high school, 15, 16, 13, 17, the parents are going to be brought into this and have to make restitution. Why? It's their child. There's assume responsibility when you have a child. So that's a great question, Tyler. I appreciate that, because parents think that you just walk away and say, hey, it's your problem now. Well, maybe it is, maybe it isn't. But at the end of the day, parents are going to be brought into this. And I can appreciate a school that says in our handbook, we do not stand for any assaultive behavior both ways. 1, against the child or the student. 2 is against the teacher. that's room for a suspension or expulsion, depending on what the hearing brings. The last thing is you destroy our property in our school. We don't need you in our school. We'd like people to be respectful and to be diligent on those that are doing that kind of behavior. Make sure you tell them, knock it off.
It's like any other behavior. You need to weigh the risk of whether or not it is worthwhile to seek that attention from people that you don't know, that frankly, more or less don't care about you anyway, or to do the right thing and simply not commit these acts for that attention because it isn't worth it. And on top of that, it's wrong. And something interesting that you did say regarding your zero tolerance policy that makes you think about, well, in some cases you have kids who have expressed repeated problem behaviors in their school. Obviously, that's going to be taken extremely seriously by their school district, and that's going to make their decisions at the district level regarding suspension, regarding expulsion, a lot easier. But in the cases of these particular challenges with the damage of property and certainly with the assault, you could be the greatest performing kid and have the cleanest record possible. But if you slap your teacher, if you're destroying a bunch of property in your school for a TikTok challenge, that's not going to be something that helps you shoulder the burden of ultimately the crimes that you're committing, especially in Macomb County where it's being taken this seriously.
And I'll tell you, Tyler, the parents ought to be aware, or at least be on the lookout for this. Anytime you see a TikTok challenge, the student is putting themselves in a position that they're going to be caught on camera from another student, which is for the cell phones and video. They're going to want to challenge themselves to get it on tape. They're committing the act of showing the police that I did it, okay? And the last thing is this. Every school I've been in has some type of monitoring devices up and down the hallways, in the classrooms at some point. Be aware that you're going to be caught on video. We have our first warrant getting signed right now for the same thing, that TikTok challenge, destruction of property. It's caught on the camera at the school. So the student didn't say I didn't do it because it's all on video. Henceforth, somebody better be wary of doing something like this because they could wreck their entire future by just one action of not thinking.
And it's also irresponsible, too, to consider this as a kid and certainly as a parent as a situation where, oh, they're not going to take this all too seriously in investigating this or in prosecuting this because I'm just a kid. I don't know any better. But there you are in that video. You're not only showing that you've committed this act, you're not only showing yourself in action committing a crime, you're also showing intent and reckless intent in many cases here, especially with the assault and in certain destruction of property. And you're showing right there on camera, hard evidence, undisputable, that you simply don't care. That's going to be looked at incredibly seriously by a prosecutor and by a judge and or a jury as well, correct?
That information comes in, a judge, a jury, probation department, school administrators, disciplinary actions that are taken. It's all discoverable and it's all actionable, and everybody's going to look at that. You have no defense to that because it shows you doing an action that was unprovoked. Unprovoked means this. You go up and slap a teacher. You start spray painting on a wall. You break property that belongs to the public. Public should hold you and will hold you. In our office, in the Macomb County Prosecutor's Office, under the direction and leadership of Prosecutor Lucido, we're not going to stand for it. Zero tolerance. Prosecute them to the fullest extent of the law, make them pay, because the public doesn't deserve this type of treatment, and neither do those people that are supposed to be educators. They're in a classroom to educate. They're not in there to get slapped in the back of the head or, beat up. That's not what they're there for. In fact, I don't call that just disrespectful. I call it downright criminal.
We're joined by Pete Lucido. He is the Macomb County prosecutor joining us on the Megacast today and transitioning from the TikTok challenges to another effort by your office. Your office recently unveiled a first in the state kind of appeals process for victims of crimes. In particular, this would give victims and their families a chance to appeal decisions made by your office when you're investigating a crime and ultimately decide not to pursue charges or to pursue charges that the families of the victims or the victims themselves believe are not just or are not proper, they can appeal this. How does that system work? And ultimately, what was the decision behind enacting this program in your office?
So, Tyler, I appreciate that question, and I hope that all prosecutors' offices follow suit on this, and it goes like this. As a former probation officer in Oakland County, as a former public defender in Wayne County, as a 30-year veteran as a criminal defense lawyer, as a lawmaker, both as a state representative and a senator, and now the Macomb County prosecutor, Peter Lucido looked at every right an individual has to go ahead and appeal a conviction or a charge that was brought. In regards to a prosecutor, you are presented by the investigation of police agencies. So in Macomb County, we have 27 police agencies, including the Macomb County Sheriff. They bring their body cams, they bring their in-car video, they bring doorbell cams, they bring written statements by witnesses. They have all the evidence brought up, and they're asking for a warrant to be signed as to these charges that they believe should be charged, they, the police. The prosecutor's office is an independent body from investigation. We do limited investigation. What we do is look at the evidence and see whether the elements of the crimes can be made as to what the officer is asking us to bring as far as charges. We then say no or yes, or we can make these other charges. And if we don't charge, the officers have a right, because they are representing victims. They're out there investigating for victims, to go to our appellate division. Our appellate division is a firewall between the warrant division and the appellate division for warrant, with a person in appeals and two that are seasoned trial attorneys, to see if the warrant division got it right. If the warrant division didn't get it right, they can issue, by way of this appeal, the warrant and have the police proceed. What recourse, and I asked the question to your listeners, what recourse do the police have if we don't issue the warrant? They got to go back to the victim and say, prosecutor's office isn't bringing charges because they don't believe they can make the elements of the crime. And this happens a lot. It's not a little bit. But why does a defendant have every right after a conviction to go appeal their conviction? Why does a defendant have a right to hold a probable cause hearing to see if there was enough probable cause for that warrant to issue as charged? I believe police officers, and I stand firmly with them, that if you don't like the decision of the Macomb County Prosecutor's Office, then bring it to the appellate division of the warrants on behalf of your victims that are out there, and let's see if we got it right in the first case. But right now, we've had a half a dozen or dozen, maybe more, maybe 20 of them, and we've had a couple overturned because prosecutors have different minds, and they think they can make the charge. And therefore, I think it's a great idea, because now you have another set of eyes looking at it to see whether or not those charges can be brought, whether those elements can be made, and whether or not we did it right.
Yeah, and the point that I love in that statement that you just made in this regard is that defendants who are being accused of these crimes, who are in some cases convicted of these crimes or in other cases acquitted, they have the right to appeal the decision of the courts, to appeal their cases after the fact and maybe have those overturned. But in the cases of those who are victims of these crimes, whether they believe they've been a victim of the crime or they are, and there's some sort of a wrongful decision or incorrect decision that's made somewhere in the process, they really don't have a whole lot of those options to say, we would like to get a second set of eyes on this. And in this case, and you did say that directly to Fox 2, where you were quoted saying you should have the right to a second set of eyes, or in this case, multiple sets of eyes, reviewing to see if what you brought is the real deal, and closed quote. That's important because in these cases, there are human elements to it. People do make mistakes. People do miss things, or in some cases, one person's interpretation is different from the other. And it's important that everybody has their say properly in the matter and that ultimately the right decision is made.
You know, it's like test taking. Some see the issues, all of them. Some see only a portion of the issues. Mm-hmm. I believe that in the criminal justice system, nothing's perfect. Absolutely nothing's perfect. We get it wrong, but we're going to win them fairly. We're going to lose them squarely. We're going to win them fairly, but we'll lose them squarely if we lose them. And the other thing is, I believe that a system that has this appeal right reduces the burden on the officers that investigated it and the victims that want that second chance of having somebody look at it to give them healing and closure as to what happened to them. But if I can't have a defendant where the elements of the crimes can be made, I'm going to put the victim through additional victimizing by not being able to make the case and put them through a lengthy trial. And that's just outright wrong. So if the defense has the same benefits and protection of the law, so should the victims.
We're joined by Pete Lucido. He is the Macomb County prosecutor joining us today on the Megacast, and it's all about the continued effort throughout the justice system and at all angles to provide that balance, to balance those scales, as is the symbol of the justice system for everybody involved, whether it be defendants, whether it be those that are the victims of crimes or those who are accused of crimes. Everybody should have an equal chance to have their case heard. They have to plead their case and to say their piece and to make sure that they're being done right by all elements of the law. Prosecutor, we appreciate your time with us today.
Thank you very much. I appreciate it, Tyler. Have a great afternoon. Enjoy your weekend that I hear is going to be a cold one, so put a coat on.
Whether you're the city,
the county,
or the Huron River Watershed Council.
As partners working together to protect our water resources, we agree.
Pet waste is the source of harmful bacteria in the Huron River.
When it's left on the ground, it can wash into the storm drains.
These lead directly to our streams. No filters, no treatment.
Here's one thing we know that can help keep our water clean.
Pick up pet waste and trash it.
Pick up pet waste and trash it.
So pick up pet waste and trash it.
There's one water, and it's ours to protect.
Welcome back to the Megacast. I'm Tyler Kieft, and that is going to do it for our shows this week as we complete our week of Megacasts here. A big thank you to all of our guests on today's edition of the show. Pete Lucido, Macomb County prosecutor. Lauren Williams, Pistons beat writer at MLive Media Group. Ed Terebus, owner of Erebus Haunted Attraction. Monique Phillips, the CEO of MP Consulting Group and the founder of Detroit Nonprofit Day, as well as Ewa Matuszewski from MedNet Health Solutions in Rochester. You can find all of our interviews on our website at civiccentertv.com/megacast and learn more about all of our partner television, radio, and other media outlets. Also, highly encourage you to go over to civiccentertv.com/coronavirus for more information on the COVID-19 pandemic and important information and resources from the Centers for Disease Control and Prevention, the Michigan Department of Health and Human Services, the Oakland County Health Division, and many of our local municipalities as well. In addition, on that page, you'll find our top articles that we post before each and every one of our programs here on the Megacast, Monday through Friday from 10 a.m. to 12 noon. They'll keep you informed from great work being done by many of our local journalists. Big thank you as well to our entire crew each and every day here on the Megacast, and especially on today's edition of the program. Calvin Brown, our studio producer and board operator, joining me to my right here in the studios in West Bloomfield Township, and quietly and still effectively over in the Troy office, Jared Clark and Larry Nyland, our Zoom producers today. Larry, of course, also our booking producer on the program as well, getting our guests scheduled for the show and then working with Jared to get them ready to come on the program and talk with us for 15 to 20 minutes about a number of different topics. Appreciate all of our crew's work. Lots of great programming coming up on all of our outlets. On Civic Center TV, coming up next, we have The Splash with Maddie Mushkin, going over a lot of what's going on here in the greater West Bloomfield area over the past week. On My Michigan TV, another interesting episode with Steve Leto on Steve Leto Live, and then we will be back on Monday morning beginning at 10 a.m. for our live shows, 10 a.m. to 12 noon. That's going to do it for this week. Thank you for tuning in to the Megacast.